In the controlled chaos of an emergency room, there are moments of incredible precision. We're talking about a procedure where one wrong move, just one tiny mistake, could mean the difference between a patient walking out and permanent paralysis. It's this high-stakes, synchronized maneuver designed to protect the most vulnerable part of the body, the spine. Today, we're breaking down the Logroll. So let's just jump right into the core problem, right? A patient comes in from a really bad accident, and you have to assume they have a spinal injury. How in the world do you move them to check their injuries or get them onto a spine board without making a terrible situation, well, catastrophically worse? The answer is a carefully choreographed procedure called the Logroll.
And when we say high stakes, we are not kidding. Any incorrect movement, even a tiny twist or a slight bend forward or backward, could literally damage the spinal cord for good. And that's exactly why there is a super strict, synchronized protocol that everyone has to follow. No exceptions.
The entire procedure, the whole thing, is built around one single, vital concept: maintaining what's called neutral alignment. Basically, the goal is to keep the spine perfectly straight. No bending, no twisting. It's like the patient's spine has to be treated as one solid, unbendable rod. Every single thing the team does is about protecting this alignment. Okay, so this brings us to stage 1, which has a pretty technical name: manual inline stabilization. But really, all it means is that the team physically holds the patient's head and neck in a straight line before anyone even thinks about moving the body. It all starts with getting control. The Logroll is a team sport. There's no way around it. It's almost like watching a dance. You've got the team leader, who is always at the patient's head. They're in charge of the neck, the most vulnerable part, and they give all the commands. Then you have other team members specifically assigned to the shoulders and chest, the hips and pelvis, and the lower legs. Every single person has one crystal clear job. So here's what happens first. The team leader gets into position right at the patient's head. They place their hands firmly on either side, and they physically hold the head and neck to stop any movement at all. From that exact moment, neutral alignment is locked in, and it absolutely cannot be broken. All right, everyone's in place. Now for the main event, the most critical part of this whole thing, the turn itself. All that prep, all that careful positioning, it all comes down to this one coordinated moment. Now, to make sure this works perfectly, there can be zero confusion. Only one person speaks, the team leader at the head. This single point of command gets rid of any possibility of someone moving too soon or too late or, in the wrong direction. It has to be perfect. And this is the command that sets it all in motion. The leader's voice has to be clear, steady. They'll say, "On my count. 1, 2, 3. Roll." That little pause isn't just for drama. It builds focus and makes sure the entire team is locked in and ready to move as one. And on that word, roll, the team moves in perfect unison. It's not fast, it's not jerky, it's a slow, deliberate, smooth turn. The whole idea is to make the patient's entire body, from their head all the way down to their feet, move like a single solid unit, like you're literally rolling a log, hence the name. But hey, the job isn't done just because the patient is on their side. The final stage is just as important, and that's all about getting the patient restabilized and secured, so there's no chance of any future movement. So after a quick check of the patient's back, the team gently rolls them onto a spine board. Immediately, a hard collar is fitted around the neck. Then, straps go across the chest, the pelvis, and the legs, locking the body to the board. And for the final touch, head blocks are placed on either side of the head and secured. At this point, that patient is completely immobilized. And the second they are fully secured, what's the very first thing the team does? They immediately reassess the patient's ABCs: airway, breathing, and circulation. The primary trauma care always comes first. So look, if you take away just one single thing from all this, let it be this principle right here. The entire philosophy, every step, every person, every command, it's all designed for one single purpose: to move the patient as one unified block while maintaining a continuous, unbroken line in their spine.